My name is Tiara. I'm a registered nurse in the outpatient surgery department at Piedmont Macon Medical. What I love most about my job is my team members. We all help one another if needed. So it's a very team-oriented place to work.
Patients, when they're coming in for surgery, there's something wrong with them to begin with that we're trying to fix. And they are not very well versed in what happens in surgery. So their pre-op nurse plays a very significant role in alleviating some of that fear and anxiety.
I had a patient come in. She was with the older gentleman. She was a younger girl. So what I usually do is I take the patient and the family back to the room. However, she kind of signaled me and asked me quietly if he had to come back with her. And I told her no. That kind of raised a red flag in my head. And I decided to ask her the psychological questions about, have you been hit at home?
Usually whoever is accompanying our patients are comfortable and they want their loved one with them. So that immediately made Tiara's senses go off.
She came and alerted me, hey, this patient has answered yes to some of the psychological questions and that we needed to look into it.
When I found out that she was in an abusive situation, I was scared for her, knowing she was going through the situation she was. It was just heartbreaking. She was crying because she couldn't get a hold of one of her loved ones overseas. So I let her use my phone to try to call.
After I alerted the house supervisor and our public safety office, my next call was to Amanda, my director. I was new to this role and I wanted to make sure that we followed every step just exactly the way Piedmont wanted us to follow it.
We wanted to ensure that we have, followed all policies and that we were doing what's best for the patient and make sure that the patient was going to be safe when they were not with us. Our biggest objective was to make sure that we could provide great quality care to this patient and care in which in this moment that they felt safe.
I'm a veteran nurse. I've been doing this a long time. That day was powerful. And seeing how everybody worked together to ensure that that lady was safe.
We found out that she was able to get away. She was provided the necessary resources she needed to get back overseas with her family. That made us all happy.
When we found out that she was actually a sex trafficking victim and that she was safe at home with her family, it was relieving. We made a difference. Tiara made a difference.
To know that one simple sentence to one of our nurses who are really that in tune, and Tiara that day was amazing beyond words and was able to comfort the patient and make sure that she had the right parties to help her and that she felt comfortable doing that. It's hard to put into words how it makes you feel. It makes you feel so proud.